First of all, I'd really like to thank the CGD for its strong technical and analytical leadership and convening power over the last 10 years. It's been a fantastic friend and supporter to GAVI, and many of the people in the room have contributed to that, addressing some of the obstacles to immunisation and lack of predictable financing. So thank you very much. The work that you did, and you've heard a bit about today, of course, led to the development of our two landmark innovative financing mechanisms, the IFM and AMC, which you've just heard about. And I understand the topic that I've been asked to talk about today is looking forward, GAVI's challenges. And in 10 minutes, that's quite a challenge in itself, I should say. But I'm delighted to be here, so thank you. Let me start by framing that question in the context of our new GAVI strategy. That's the GAVI strategy 2011 to 2015. And then I'm going to pick a few key elements of that to talk about the challenges. As I imagine most people in this room know, that GAVI is a public-private partnership and a financing instrument. We're not an implementing agency. And the GAVI board is truly multi-stakeholder. You can see that. I won't go into detail because I think most of you probably know, but it is very much a public-private partnership. And for me, this is both its strength and a source of inspiration and innovation, but it's also a challenge. A 28-member board is not always easy, but I think it's worth the challenge. But if we're talking about challenges, the board is, the public-private partnership is, as I said, both a strength and a challenge as well. So let me just move now to the new GAVI strategy. Starting in late 2009 and through the first part of 2010, there was a lengthy consultation on the new GAVI strategy that would take us forward for the next 5 years. Critical years. There were clear instructions from the board that the strategy should be aspirational. We asked, and the board members said, no, we don't want you to limit it in the context of the current economic environment. We need to deal with that through the business planning process and, if necessary, prioritisation. But we want this strategy to be aspirational, taking us forward. And they also said that the strategy that was current at the time, the 2007 to 2010 strategy, was pretty okay. So what they were looking at was some fine-tuning. And we also drew on the emerging themes from what's called the GAVI 2 evaluation that was underway at the same time. And so these are the 4 strategic goals that the board endorsed in the middle of last year. You can see there's the accelerate the uptake of vaccines, the contribution to strengthening the capacity of integrated health systems, and the increased predictability and sustainability. These are not very different to the goals that were already in place. Although what is different moving forward, and this was a very clear message we got from the evaluation, was that this new strategy moving forward also includes specific strategic objectives and performance indicators so we can measure ourselves, and a measurement process that we keep reporting on. And also we've done some strong policy development over the last few years that will also underpin the implementation of this strategy. But it's strategic goal 4, that's the new goal, and it's about market shaping. We've always, as you've heard from both Alice and Michael, we've always had an approach based on the belief that a key component to sustainable development is to change the way the markets work. And in our case, that's the vaccine market. And actually, GAVI's basic business model is about market shaping. It's led to vaccine developers and manufacturers paying more attention to the developing world market. Because frankly, before, very few manufacturers saw any real opportunities, and therefore it was quite a fractured market and an uncertain market. As Michael said, it was one that was not, the products were not necessarily targeted to be the most effective in developing countries. And by definition, it was one without any serious purchasing capacity. So I think that what GAVI's done is changed both sides of the market equation. On the one hand, thanks in large part to IFM and AMC, we've secured a significant level of donor funds, and so we represent a serious purchasing power. And on the demand side, we aggregated developing country demand by bringing together half or more of the annual birth cohort. So that's a pretty big volume. So we have supported the development of new markets through accumulation and aggregation, and that's a basic feature of the GAVI model. However, we now need to be clearer and I think cleverer about where the levers lie in market shaping. What are the drivers of cost? Where does GAVI have relative market power? What is it more targeted that can shape markets? And that was one of the reasons why the board decided very clearly that we should have a clear strategy. Just to talk about some of the levers, just some examples. We know, for example, that the pentavalent market, GAVI has significant market power and represents a large proportion of market volume and value. These figures are quite approximate, but it may be as much as 75%. So we've got a lot of leverage there. However, we know that the pneumococcal market, we've got less market power, but we have a success through the AMC. So the AMC has allowed us to lever. For rotavirus, that's still an emerging market, but we've got moderate market power. So the new GAVI strategy moves us from more of what I think we would describe as market watching stance to an active market shaping, and it elevates market shaping to a strategic goal with two clear objectives. And the objectives in the new strategy are, first, to ensure adequate supply to meet demand through diverse supplier base, providing products that meet country needs. That's one that can be discussed. And second, to minimise cost of vaccines to GAVI and countries. We currently have a board task team that's being chaired by USAID that's in the final stages of developing a new strategy for supply and procurement for 2011 to 2015, and that will go to the July board meeting, and that's going to be a big focus and a challenge for us moving forward. Let me just touch briefly on the AMC, and I don't want to cover too many of the things that Michael's covered, and this is clearly somewhere where we've been market shaping. I think that the signing of long-term binding commitments to supply a fixed amount of vaccines per year at a predetermined price is really unprecedented. It's a huge shift. And despite our detractors, I think the price of $3.50 can be considered a significant achievement, as it represents nearly a 90% price drop. And it's allowed the vaccine to be available very promptly. In fact, the newly crafted vaccine that's targeted to developing markets, the PCV 10 and 13, is actually reaching developing countries within the 12 months, same 12 months it's reaching here in the US, for instance. And having been now at a number of the launches, Nicaragua and Kenya most recently, it's just extraordinarily rewarding, I have to say, and quite humbling to see the enormous enthusiasm of parents, largely mothers, I have to say, coming forward to have their children vaccinated. It's a huge achievement, I think. The AMC's also given us huge advocacy power. It's because of the innovative design of the AMC that's received so much attention that's led to increased awareness and attention to pneumococcal disease, to the power of vaccines, and to GAVI's role. And I don't think we can underestimate the advocacy role, all of which is extremely helpful at a time of shrinking ODA budgets. And we really need to scale up so we can deliver the promise of these vaccines. Just let me talk then briefly about Strategic Goal 3, which is about increased predictability and improved sustainability. David's going to talk, the predictability part is around global financing, and I'm going to leave the innovative financing part to David, who can speak much more eloquently on it than I can. But I want to comment briefly on the sustainability aspects of the goal, which relate to national level financing. Co-financing of new vaccines has been a policy of GAVI for a long time, but last year the board approved a revised co-financing policy. Previously, it had been a small amount that they co-financed, and it was more about country commitment than it was about moving countries to sustainable financing. We now have a policy that's three-tiered, and for those countries that are what are called graduating from GAVI in 2015, they're going to be on a trajectory of co-financing that should get them at a point when they stop being eligible for GAVI funding that they have on their own books funding for it. But, and it's interesting talking in the context of our resource mobilisation need, I think sustainability is a lot more than just about co-financing for the vaccines. There's a clear message that we're getting from donors as we head towards the GAVI pledging conference, which I'll talk about, that it's more than just a demonstration of country ownership. It's more about country ownership of health as a development driver and vaccines as being a key investment in it. And this is what donors certainly are wanting to see more of, and as importantly, countries are wanting to see more of it themselves. And this movement will take us beyond ministries of health, which has been currently where GAVI has largely focused, definitely into ministries of finance, treasuries, and to political levels. So it's actually moving us up and out a whole dimension. So what can we deliver in what people would call perhaps GAVI Phase 3? With the new vaccines incorporated into GAVI's program, we estimate that an additional 4 million future deaths can be prevented by 2015. And WHO advises us that in the first decade, GAVI supports help to immunise an additional 280 million children and prevented over 5 million future deaths. So we have the vaccines to prevent many of the major child killer diseases, including the major causes of pneumonia and severe diarrhoea. Perhaps I could have the next slide. You can see there, that's pretty compelling, the causes of child deaths in low-income countries. You can see pneumonia and diarrhoea take up 36% of child deaths under 5. So this is a huge opportunity. We can almost double the rate of GAVI lives saved in the last 10 years in the next 5 years. But we do need to see donors and countries step up their contribution and vaccine prices to fall. My Norwegian colleagues call this the three-legged stool. So it's about donor money, it's about lowering prices, and it's about countries' contribution. And I think those are our big challenges moving forward. Before I finish and hand over to David, I guess it's always nice to have a slide from our sponsors, and you've seen the huge contribution that the UK have made to date, and with a change in government, a change to a Conservative government that has a slash and burn for domestic funding, I think it's enormously to their credit that they have retained their commitment to ODA. They did a very large multilateral review of their 43 internationally funded organisations. In the words of the Secretary of State for Development, Andrew Mitchell, he said, "We took a long, hard look at the value for money offered by 43 international funds and organisations through which the UK spends its aid and considered how effective each organisation was at tackling poverty." And this graph, which we take from their report, plots those organisations against their organisational strength on the vertical axis and their contribution to development objectives on the horizontal axis. And 9 organisations, represented by the green diamonds on the top right-hand side, were assessed as being very good value. Needless to say, it was incredibly heartening to us to see where GAVI sat. This is a comment on the huge contribution of individuals and agencies over the last 10 years, including many of you who are in this room today. So I think this is an enormous collective achievement. So we have a pledging meeting in June, as Amanda flagged. The opportunity for new commitments will be there at that June the 13th meeting that the UK government is hosting. It's attracting a lot of attention, a lot of hard work. I don't think we've ever been in the spotlight, and I defer to others who have a much longer history of GAVI. I don't think we've been in the spotlight at such a high political level before. Prime Minister Cameron is going to open it. Prime Minister Stoltenberg is going to be there. Bill Gates is going to be there. Raj Shah is going to be there, we hope, yes. President Sarkozy, maybe. So we're on a roll. The aid landscape's changed. The fulcrum of economic power is shifting. I think that we need to focus more on emerging economies. I was very interested in the slides that you showed, Amanda. As they're key players, the emerging economies, both financially and also in terms of vaccine production. But I think there's a hugely positive momentum. It's very exciting, and it's also challenging. And as I just finish with the sort of three-legged stool, donor money, vaccine prices, and country contribution. So thank you. I'm going to hand over to David to talk about the innovative financing part of it.